My name's Janine. I'm the team manager for the Knowsley assessment and home treatment team. The Knowsley assessment and home treatment team is a specialist mental health service for adults, so that's anyone over the age of 18, and we're an ageless service upwards, and we're here to provide a service for people that are registered with the Knowsley GP within the Knowsley area. We're a 24-hour, 7-day-a-week service. We have a team based at the Knowsley Resource and Recovery Centre over in Wiston. In the team there's a numerous number of staff from admin workers, medical secretaries, specialist pharmacists, consultants, nurse practitioners, support workers, and we have regular multidisciplinary team meetings with our other agencies, such as our recovery service, eating disorder services, criminal justice liaison services and also the inpatient services. So, as I said, we're a specialist mental health service, and we provide assessment and specialist intense home treatment support for people that suffer from moderate to severe mental illness. Now, the range of mental illnesses range from people with depression, anxiety, to more enduring mental illnesses of schizophrenia, psychosis, mood disorders, bipolar. And when I said moderate in nature, that's people that perhaps might be the first presentation but require more intense intervention, and such as their illness is actually impacting on their daily functioning. This is a confidential service, and we do promote people to contact us, and the advice that we're given is confidential, and we don't want people to be fearful of contacting the service to feel that once they're involved with the service they're never going to leave a mental health service. I have worked in mental health services for many years now, and I've worked alongside people that I've been able to have brief interventions from the service, but have gone back to full-time employment. We have people that access the service that are maybe in full-time employment but are having those difficulties and require that support, but they're able to work with us, so it's not impacting on their commitments with work, family. Or we have people that, unfortunately, due to their illness, that they're not able to work at the moment, or that they're finding that their illness is impacting on their daily functioning. But following interventions or support, maybe from our service or from other services that we signpost them to, such as wellbeing enterprises, the advocacy services, drug and alcohol services, that they are able to be discharged and to move on to fulfil full-time employment, or to fulfil a happier, healthier lifestyle again. As I said, the team, we're a 24-hour service, 7-day a week, during the hours of 9 to 5, Monday to Friday. There is an admin member of staff that are very experienced and can offer advice in relation to certain contact numbers within the Knowsley area. However, we always have a duty practitioner, and it's a senior nurse practitioner that is very knowledgeable about the Knowsley area and the services that are available, not just from the NHS services, mental health services, but all of the voluntary and primary care sector services, that we can, if people do ring and it might not be our service that is the service that is required, then we could always signpost or even transfer that call to the appropriate service that could help. We're aware that there is a stigma, or a perceived stigma, about mental health, and we're really trying our best to tackle that and stamp out stigma. Is that promotion for the 5 boroughs. We want people to break down that barrier, and we don't want people to suffer in silence, and that's to even just pick up that phone, ask a question or talk about your difficulties, because there is always help and support out there, maybe not from the team that you're ringing at that point, but there is always another service or support that is available. 1 in 4 of us may experience, you know, mental illness or difficulty at some point in our lives, and we want people of Knowsley to be able to see that it's nothing to be ashamed of, and that, you know, there is that support that can help you through that difficult period. As part of the specialist assessment that we offer in the home treatment service, that we do provide education and education materials around understanding illnesses and diagnosis, and that a diagnosis isn't something to be afraid of, and we don't want it to be seen as a label, but it does open up that treatment pathway and support. For example, you know, people may have heard the diagnosis of bipolar disorder, but again, that doesn't mean that it's a label, and it doesn't mean that you're not able to have a happy and fulfilled life and achieve what you want to achieve in life, such as full-time employment, children, family, and we want people to move away from that, and it's about working with people's priorities, and then working with people to identify their own needs and goals, such as what they perceive as their main difficulty, and we will try and help them to our best ability to work with that problem area, and therefore so they can then fulfill and move on and you know, through that journey and that recovery. Our assessments, we do offer assessments based at Knowsley Resource and Recovery Centre at Wiston. However, we understand that people are not always able to travel, or again may have some fear in relation to attending environments like this, so we will try our best to engage that person the best that we can, and that may include that we do home visits, visit people at the GP surgery, or at places where they feel more comfortable, such as local community centres. Team being that we are, there is a different range of professionals and different experiences within the team, but we've all got life experiences as well, and that we're a very caring, a committed team, and you know, we want to provide a quality support and service for the people of Knowsley. We are genuinely, you know, caring people, alongside having that knowledge and that experience in the field of mental health. But the people in the team, you know, do, you know, have compassion and do generally care about the people that they work with. If in doubt, please just pick up that phone, contact the team. The telephone number is 0151 676 5263, and we're available 24 hours a day, 7 days a week.